WHO that by year 2030 that the psychiatric disorders will be the number one cause of morbidity and mortality in the whole world, no? In every 40 seconds, there is someone who is attempting to commit suicide.
The more important is psychosocial support. Support from family, community, from friends.
Walang iwanan. Nobody should be left behind in this crisis. After my 4 years training at the National Center for Mental Health, because this is where I wanted to become, to help the mentally ill, no, to change lives. I had one acting spree nung nasa UST wherein I got the role of Sisa. Surprisingly, so nakakatuwa. Looking back, oh my gosh, naging profession ko tuloy yun. My parents would tell me before, sure ka ba? I would tell them, yeah, I'm very sure. I became a psychiatrist. No? And I have no regret. I've been practicing my field for 2 decades already. We are about 500 to 600 psychiatrists all over the country. Sad to say also that our population is one psychiatrist over 100,000 population. I also have experiences na nagkamali ang aking intuition. Muntik na ako natamaan ng isang patient. But I was thinking na this is not them. It's the disorder that made them really aggressive. Since it is pandemic right now, just like other countries, mataas ang incidence ng anxiety and depression. It's more of anxiety right now. Ano na mangyari sa atin? Paano na lang ang future? Hanggang ngayon ganito pa rin. Trauma due to deaths in the family. Tumataas ang incidence ng psychiatric problems. It is true also in the Harvard study that the pandemic can cause anxiety, depression, post-traumatic stress disorder, and domestic violence. Karoon ng mga issues like may nakawan, psychiatric symptoms that may warrant attention. It can be like hindi na siya katulad noon, na gandang functioning niya, nalulungkot, no? Hindi nakakatulog, hindi nakakain, nagmumukmuk lang sa isang sulok, o dati siyang sociable, ngayon hindi na. Or may mga episodes din na parang tulala siya, or ang daming mga sinasabi, or may naririnig na mga boses, no, or may mga hinala. Here in the Philippines, we already have the mental health law wherein it states the rights of psychiatric patients na hindi sila pwedeng hindi pagbibigyan when it comes to their concerns about their health. They should be given also the chance to work or be a member of the society. Anxiety kasi can be normal, lalo na ngayon sa pandemic. Pero kapag ito ay hindi ka na nakakapag-work at dami nang naapektuhan sa buhay mo, feel free, no, to ask help. Ang importante dito, the earliest na maagapan natin, makakabalik ka sa normal mo.
One is the big contributor to the death causes in Indonesia is cardiovascular disease. But however, mental disorder is the biggest contributor to disability. And the stigma about mental illness is still strong here. Access to medication is not better in Indonesia. I come from an ordinary little family. I grew up in a little town in central Java. I am a licensed psychologist in Indonesia and have a psychological consultation office in Tangerang. I have many ideas for children and families and also communities. And if I share my ideas to the big established organization, then maybe they don't want to accept. Then I thought, why don't I just find my own organization? And then I share my idea with my two other friends in 2009 with family organization. So I think in the future is Germans. The future it's not a place forever. We don't want that our client depend on us, but we want to bring back the kinder or the children to the family. The most common mental illness-based data from Health Ministry in 2017, depression and anxiety. I think different from this current situation in Indonesia. The most common is actually in adolescents. Three main causes of mental illness disease. The first is social factors, the impact of stressful life events, problem with family member, problem with close friend. Second is a psychological factor. It is actually the way of people thinking about self, about others, and about community or about everything around him or herself. Genetic factors. So what are inherited factors is actually the neurochemical fluid affecting emotion, brain structure, common myths about people with mental illness. First, causes. For causes, many of us or in the community, they think that people with mental illness, they just lazy. So they deserve karma, or maybe they have a moral failure, or maybe caused by possession by demons. Actually, they have disturbance in unusual breed. Then the second is the people, they thinking that people with mental illness are violent. But actually, in the reality, people with mental illness are more likely to be victims for the treatment of having mental illness. People said don't take all the medicine that have been prescribed by the doctor because it causes addiction. And but I think that the doctor, they must have considered the appropriate medication. So we is doing the online and offline psychological counseling. For family, it's for adult, it's for teenager also, and for children. We had a topic about insecurity. Also, we had online seminar about fathering. So we are promoting the parenting. A family with its member having mental disease will cover up or hide its member. Somehow it makes the medication more difficult. We have also a program, psychoeducation about stigma, and we do this on Instagram and also website articles. And we have this program until next year's. It's called Beat the Stigma series. And then we are doing also a professional consultant for the development of the DOOF application. It's an application on iOS 13. application is for reducing psychological symptoms, mostly depression and anxiety. We direct psychoeducation to the community and hope that with my testing, the stigma will reduce.
How would you say that it is normal when it's not normal? How would you say na we are good when we are not good right now? I think it's more of adjusting to real life situations, having peace within yourself and learning how to cope with situations right now.
So people, you all deserve love and peace. Always learn to love yourself, because from loving yourself, you will gain your own love.
I am Dr. Babes Rosena, a psychiatrist.
I am Linda. I am clinical psychologist, and this is my voice
This is my voice on
on
hashtag here for you.